Okay. I think now we have no problem. So it's audible, right? Is it audible, right? Are you able to see my video right now? Okay, fine. So shall we start the slide sharing now? Okay, now you'll be able. You're now able to hear me. Are you able to see my screen?
Yes, sir.
Okay, so fine. So I think you can unmute your video so that it will be very easy. That network very much issue over here because we have a little bit of rain over here. So I think if your video. Okay. So coming to the point. So yeah. So cancer treatment modalities in Ayurveda. Coming to the next slide. So what is cancer? You are made up of trillions of cells that of your lifetime, normally grows and needed. When cells are abnormal or get old, they usually has to die. Cancer starts when something goes wrong in this process and your cells keep making new cells and the old or abnormals do not die and when they should. So what happens? As the cells grow older, they really has to vanish or it has to die and that place has to be taken place by the newer cell. This is the catabolic and anabolic process which is occurring in our body. Okay. Now the old ones when does not die and it says that I stay here, I will not die. So the cloudification of cells one over the other, it keeps on accumulating together forming some sorts of cancer. So this is the basic simple idea which I am giving to you. As the cancer cells grow out of control, they can crowd out the normal cells. This makes it hard for your body to work the way it should. So types of cancer. There are many types of cancer. Cancer can develop anywhere in the body and it is named for the part of the body where it started. For instance, breast cancer starts in the breast. Is still called as breast cancer even if it is spreads or metastasis to other parts of the body. That is where the cancer initially started. So based on the parts where it started, we nomenclature it as the based on the location. There are two main categories of cancer. Hematologic, that is blood cancer, are the cancer of the blood cells, including leukemia, lymphoma, and multiple myeloma. Solid and second classification is that is one blood cancer and is solid tumor cancer, where blood is related to the blood, and second where you feel a lump like things are the cancer of any other body organs or tissues. The most common solid tumors are breast, prostate, lungs, and colorectal cancer. Nature of cancer. These cancers are alike in some way, but can differ in the way they grow, spread, and respond to the treatment. Some cancer grow and spread fast, and other grow more slowly. Some are more likely to spread to other parts of the body. Other tend to stay where they started. So a tumor is a lump or growth. Some lump are cancer, but many are not. Lumps that are not cancerous are called as benign. Lumps that are cancer are called as malignant. So for example, fibroadenoma of breast is a benign. It's not a malignant. Malignant becomes a cancer, where benign means nothing to afraid of it. It's something a lump, it will not destroy you or disturb you in any way. So Cancer cells develop because of the multiple changes in their gene. These changes can have many possible causes. Lifestyle habits, genes you get from your parents, and being exposed to the cancer causing agents in the environment can all play a role. Many a times there is no obvious cause. So we call it as idiopathic cause. So common causes of cancer, what are they? Learn about some of the most common causes of the cancer, and what do you can do to lower your exposure the risk. That is smoking and tobacco, diet and physical activity, that is less taking heavy bakery items, less physical activity, sedentary lifestyle. So sun and other type of radiation, that could be x-ray, that could be any exposure to harmful rays. Okay, so where the ozone gas is not there, ozone layer is being destroyed. So at that time, if you expose your body to the sun, probability of getting cancer is high. Viruses also can mediate the cancer. Actually, our RT-PCR basically started in 30 years back. When it was started, actually the main motive of RT-PCR, whatever we use today for doing the corona test, to that actually it was been found to see whether there is a possibility of virus strain for the induction of cancer. This was the actual purpose of the RT-PCR. So cancer are classified in two ways: by the types of tissue in which the cancer originates, so according to the histopathological type, and by the primary site or the location in the body where cancer first developed. This section introduces you the first method of cancer classification based on the histological type. The international standard for the classification and nomenclature of histologies is International Classification of Disease for Oncology. From here we can get 6 major categories, that is carcinoma, sarcoma, myeloma, leukemia, lymphoma, mixed type. So let us see what are those. So carcinoma refers to the malignant neoplasm of the epithelial origin or cancer of the internal or external lining of the body. Carcinoma malignans of epithelial tissue accounts for 80 to 90% of all the cancer cases. Epithelial tissue is found throughout the body. It spreads in the skin as well as the covering and the lining of the organs and internal pathways such as gastrointestinal tract. So that is called as carcinoma. Okay. Now coming to the next point. What is sarcoma? Sarcoma refers to the cancer that originate in the supportive and connective tissues such as bone, tendon, cartilage, muscles, and fat, generally occurring in young adults. The most common sarcoma often develops as a painful mass on the bone. So sarcoma tumors usually resembles the tissue in which they grow. Example, sarcomas are osteosarcoma. Okay, next myeloma. Myeloma is a cancer that originates in the plasma cell of bone marrow. The plasma cell produce some of the proteins found in the blood. What is leukemia? Leukemia is called as blood cancer also, are called. So it is from the bone marrow. The site of the blood cell production, as I have told you, it's from the bone marrow. The word leukemia means white blood in Greek. The disease is often associated with overproduction of immature white blood cells. These immature white blood cells do not perform as they want to do their job. Therefore, the patient is often prone to infection. Leukemia also affects red blood cells and can cause poor blood clotting, fatigue due to the anemia. So all these things are being the cause of leukemia. What is lymphoma? Lymphomas develop in the glands or the nodules of the lymphatic system. A network of vessels, nodes, and organs, specifically the spleen, tonsils, thymus, that purify body fluids and produce infection, that is fighting white blood cells or lymphocytes. Unlikely the leukemia, which are sometimes called as liquid cancer, lymphomas are solid cancers. Note the point. These are the solid cancers. Lymphoma may also occur in specific organs such as stomach, breast, and brain. These lymphomas refer to the extranodal lymphomas. Mixed type. What is mixed? The type of components may be within one category or different category. For example, adenosquamous carcinoma, mixed mesodermal tumor, all those. When we mix the above categories of 5, totally 6 we have told, in relation 1 or 2, mixing 1 or 2, 1 or 3. So this causes mixed one. So tumor list. Different body tissue gives rise of different tumors, both benign and malignant. The following table show the different kinds of tumor. Each of the following tissue types are vulnerable to connective tissue, endothelial, mesothelium, all those things. So it related to that we develop cancer. So one more thing there is called as gonadal tumor. The terminology gonadal tumor or tumor of the ovary and testes is somewhat more confusing. One general class of tumor arises from multipotential cells that give rise to tumor containing a variety of tissue types, often within the same tumor. These germ cells tumor include seminoma, okay, choriocarcinoma, embryonal carcinoma, endodermal sinus tumors. Okay, so all these related to the gonadal tumors. So cancer type, as I told you, based on the location. So cancer can be classified based on either on histological type or the primary site. As I have told you, I have told related to the histopathological, and based on the site also I explained. Derivation of the cells and tissue starts within cell differentiation, which refers to the process of cell becoming arranged into 3 distinct germ layers: an outer ectoderm, inner endoderm, and mesoderm in between. All the organs of the body develops or differentiate from these 3 primary germ layers. Tissue is composed of group of cells that are similar in structure and perform one or more common function. Okay, understood? Tissues are composed of groups of cells. Just the example, liver, heart is a group of cells. It is assigned to do a particular function. That is called as tissue. 5 major categories of cancer based on their histological categories are carcinoma, sarcoma, myeloma, leukemia, lymphoma. All this I have told you. In addition, there are also called there is mixed type also. The most common site in which cancer develop include, based on the site, skin, lungs, female breast, prostate, colon, rectum are the and uterus are the most common seen cancer. So how it is been diagnosed? The diagnosis of the cancer entails an attempt to accurately identify the anatomical site of origin of the malignancy and the types of cell involved in it. So cancer can arise in any organ or tissue in the body except where cancer cannot be developed: fingernails, hair, and teeth. These are the 3 things where cancer cannot develop. The sites refers to the location of the cancer within the body. The body parts in which cancer first develops is known as primary site. So primary site is the site where the first development of cancer starts. A cancer primary site may determine how the tumor will behave, whether and where it may spread, metastasis, where it can spread, and what its symptom most likely to cause. The most common site in which cancer develop include skin, lungs, female breast, prostate, colon, rectum, okay, corpus, uterus. Secondary site refers to the body parts where metastasized cancer cells grow and from secondary tumors. A cancer is always described in terms of primary site, even if it has spread to the another part of the body. For example, advanced breast cancer tells that has spread to the lymph nodes under the arm and to the bone and lungs is always considered as breast cancer itself. However, it has been spread to lungs. We will not call it as lung cancer. Rather, we call it as breast cancer itself. And the spread to the lymph nodes, bones, all these things. Getting the point. As the case in the medical condition, there are many signs and symptoms that may indicate the presence of cancer. These may observe directly through imaging technology or confirmed by lab test. However, these signs and symptoms of cancer may resemble those of other conditions. For example, weight loss, abdominal pain caused by the stomach cancer or an ulcer. Pink or reddish urine can be caused by kidney cancer or a kidney infection. A positive fecal occult blood test can indicate the variety of intestinal problems. A biopsy is preferred to the establish or rule out or diagnose a cancer. So biopsy is must and should, where if you are able to confirm it, so possibility of biopsy is very good, but if you go for a biopsy, possibility of spreading is also high. So you have to keep it, all those things in our mind. So how we can grade, it is a first case stage cancer, second stage, third stage, fourth stage. So based on the cells differentiation, we will be able to make it out. If it is less differentiated, then we can call first stage. If it is more differentiated and it is not looking in as normal as the normal cell, second. In the same way, first, second, third, and fourth will be more severe. So cancer factor. So more than 1.2 million Americans develop cancer each year. A new cancer is diagnosed every 30 seconds in United States. Since 1990, nearly 15 million new cancer cases have been diagnosed. These estimates do not include carcinoma in situ, that is invasive cancer. So lungs and prostate cancer are the top cancer killers for men in United States. Lungs and breast cancer are the top cancer killers for women in United States. 1 in 2 men in US will be diagnosed with the cancer at some time during his lifetime. 1 in 3 women in US will be diagnosed with cancer at some time during her lifetime. So it's very much scary, all these things which we will getting the data. So we have to understand why it is developing. So let us understand what and how it is now, and I will be explaining my thought process in the later on session. Cancer is the second leading cause of death after heart disease in United States. It is the primary cause of death in women between the age of 35 to 74. About 8,000 American children will be diagnosed with cancer this year. So cancer is chief cause of death in children between 1 to 14 years. It has not left even the small children also. History. 1970, the American people knew what they wanted, to a cure for the second leading cause of death. So President Nixon headed the voice of the people and concern of the medical profession. So what are all the things? You can just go through it. Fact. So however, scientists are still not able to pinpoint the cause for the cancer. Instead, cancer researchers now believe that cancer can be triggered by many factors such as genetics, diet, occupation. We know that our chance of developing a cancer can be significantly reduced if we choose a healthy lifestyle, not smoking, avoid certain foods. So finally, while a cure for cancer has not yet been found, scientists are more confident than ever that future breakthrough in the cancer detection and therapy are not far away, allowing us to effectively control the disease. Hope for the best. This is what the thought process in the scientist. So what is the vision of Ayurveda? Ayurveda defines a healthy, that is, what is healthy? Swastasya, what is swastha? So when healthy, swastha body has the balance of tridosha, samagni. Okay, all the 7 dhatu should be strong. Agni should be strong. Okay, mala, prasanna atma, he should be very happy in his atma. Indriya, manas should be in equilibrium. However, all these, if it is been okay, then he is called as swastha. So whenever there is an imbalance in manas, definitely all the possibility of toxins encircling our body starts. So first toxicity starts not by the food, not by the diet, not by the surroundings. It starts by the manas itself. Because whatever the food you take, you have got a beautiful immune system, you got beautiful liver, you have got 32 trillions of bacteria and virus, almost 2 kg of body weight is being occupied by your bacteria and virus. So which can easily kill whatever the toxins in the way of pesticides, in the way of whatever the things, whatever you take. So it will destroy it. Anyhow, if you take a simple tablet, If you take a paracetamol 650 mg, when it enters into the bloodstream, only about 10% of paracetamol is really active. Rest everything is being destroyed in the stomach and later on by the liver cells. However, liver cells, little bit of liver cells will be damaged. That is a secondary matter. So what efficient means, what I would like to tell you is that nothing from outside can cause you a cancer. However, the thought process is more stronger. Thought process is more stronger than what do you call the toxins from the outside. Excuse me, just a minute. I'll come back. Yes, sorry for the inconvenience. So, as I told you, the thought process, because I will tell you one example. When you hear this example, you will be able to understand whatever I was telling is perfect. See, a patient came she is around about 32 years. She was telling that that is 4-stage cancer. It has been already metastasized. So it was completely blocking her, what do you call, GI tract. So esophagus was completely blocked. So she was not able to deglute even her own saliva. So at this stage, when I was seeing her nadi, and I told Sue, you have got some angry towards someone. What was that actually? Since 10 years, she was very much had very much angry towards her mother-in-law, and she used to take many gastric tablets. Since then, see what is the association of manas? Since 10 years, it took to form a gastric cancer, or sorry, stomach cancer. So in a way, if you go through each and every cancer patient, I bet and I will challenge you, definitely there will be something association of the manas in respect to kama, krodha, mada, matsarya, irsha. So definitely go through that, and if at all, if you are able to correct that process of thinking, definitely you will get result. So whenever I have counseled her, when she thought that definitely, yeah, definitely, yes, it's my mistake and I will correct myself. In a way, she was able to drink a sip of water. So I think that could be a miracle, whatever you think so, but definitely not. Manas has that much capacity of retrieving the cancer itself. Quite recently, I have shared my one of the patients' report where he took only 1 month treatment of cancer. You can see a drastic change where that it was a 4-stage, it was a stomach in the primary site. So it has metastasis to the liver, kidney, okay, elsewhere. So definitely what happened after the scanning, so one kidney was completely okay. Another kidney was, whatever the tumor was, it was been shrink down. So the gastric tumor also shrink down. Liver, 2 lobes has been affected. Now only 1 lobe with only the size has been shrink down. So with the patient also feels happy and he is able to walk, he is able to work, he is able to do all the daily routines. However, he has been advised that if at all if we give chemo radiation surgery, definitely we cannot assure him to live more than 2 to 3 months. So definitely 1 month passed and now he's like a hatta katta pileman itself. Now you can accept that he can go more than not 3 months, he can go up to 10 years also, no issues. So I am telling you, concentrate on the manas so that all the things will start from the sarvadosha prakopadam. See, prajnaparadam tam vidya sarvadosha prakopadam. Okay, so if you willingly, intentionally you are doing some mistakes, so that will cause the sarvadosha prakopada, vata, pitta, kapha, everything will be under high. So if you are able to control your manas, it will come automatically into the normalcy. Definitely whatever the treatment you give, definitely he is going to respond to the treatment, not because of your treatment, it's because of your manas. The same way I teach these techniques and you get results also. Coming to the next point. So there are so many reasons for this. Comparing to the present era, the earth, air and water, were not polluted in ancient times. The food and lifestyle were so healthy and was in accordance to the nature. Chemical adulteration were almost negligible. People were less tensed. Okay, this is note this point, less tensed, and they did not have I want more, nothing like that. So lived harmony with nature. So use of synthetic and artificial items were not part of life. So where we are not able to live without that. So more than that, they follow a good and sincere spiritual life. This is very, very much important. Underline this point, a spiritual life. Classification of Arbuda. We call cancer as Arbuda, and Shishruta has given classification. Based on that, it is being told that Vataja Arbuda, Pittaja Arbuda, Kafaja Arbuda, Raktaja Arbuda, Mamsa Ja Arbuda, Medaja Arbuja. So all the 6 types has been told. So you can compare in this way. Vataja Arbuda can be compared to the carcinoma affecting lungs and bladder, GI tract. So what we can call it as carcinoma. So Rasa Dhatu is affected, skin, epithelial, squamous cells. So breast and prostates, everything will be affected in Vataja condition. Okay, Pittaja Arbuda can be compared to the sarcoma, which affects the bone, tendon, muscles, and cartilage, where Mamsa, Asti, and Meda and Asti is the Dhatu which is involved in it. Kafaja Arbuda, myeloma, develop in the plasma cell of the bone marrow, that is Majja. Raktaja Arbuda means leukemia affecting the white blood cells and red blood cells, that is Rakta Dhatu. So Mamsaja Arbuda means lymphoma affecting lymphatic system, tonsils, spleen. So Mamsa means stomach, breast, and brain. So Mamsaja Arbuja. So Medaja Arbuda means mixed type like adeno squamous carcinoma. Meda, that is Meda is the carcinoma, teratocarcinoma. So this is the ideology of the Acharyas. However, the classification resembles our Ayurvedic classification also. So coming to the Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra are the 7 dhatus. So now you can be able to understand when Vata enters into the Rasa, it forms something. Rakta, it forms something. So when Vata is very much high, it causes multiple cell division. It causes multiple cell division, and where the tumor starts developing. So the first controlling of Vata itself is the first and foremost thing that we have to do in the treatment of the cancer, because for each and every disease has to occur. Without Vata, the displacement of Pitta and Vata is not at all possible. Getting the point. Treatment. There are many types of cancer treatment. The types of treatment that will depend upon the type of cancer you have, and cancer you have and how advanced it is. Some people with cancer will have only one treatment, but most people have combination of treatments such as surgery, chemo, radiation, and you may have also heard about immunotherapy, targeted therapy, or hormonal therapy. Let us look into it. Okay, so what are chemotherapy? So alkalinating agents are most active in resting phase of the cell. These types of drugs are cell cycle non-specific. There are several types of alkylating agents used in chemotherapy, that is mustard gas derivatives. What is mustard gas? The Hitler who has used to kill thousands of people in a tanker, you might have heard that, by suffocation. So the same thing we are using to kill the cancer cells over here. Then in the same way, many things it has been told, just you can go through. These are all the things we are using chemotherapy agents. Then what are plant alkaloids? It's a very beautiful thing, where plant alkaloids are chemotherapy treatment derived, made from certain types of plants. So among that, Vinca rosea, that is Vinca alkaloids, are made from the plant, that is Sada Pushpa or Nitya Pushpa, whatever we use in our garden. It has got that potentiality, where actually the story behind how the Vinca rosea was being established, the stories becomes like this, where the Daru Haridra, South Indian Daru Haridra, that is Coccineum fenestratum, was being exported to the foreign countries. So we are running out of time, only 10 minutes more. So in a way, we are very much good in adulteration, where we collected the roots of Inca rosea and we sent to them. So where they thought, what is the new thing over here? When they found out that there is a more potentiality in Inca rosea, they when they go through that, they understood that it is more potential treatment in cancer. So that it is how the cancer treatment has got the plant alkaloids over here. So in the same way, you can go through that. What are other things? So anti-tumor, that is anti-tumor antibiotics are chemotherapy agents made from the natural products produced by specific of soil fungus. Okay, so these drugs act during multiple phase of cell cycle and are considered as cell cycle specific. Okay, these are several types of anti-tumor antibiotics. Getting the point? Just you can go through that. So anti-metabolites are the types of chemotherapy treatment that are very similar to normal substance within the cell. When the cell incorporates the substance into the cellular metabolism, they are unable to divide. So this will cause the destruction of the cancer cell. So this is the one more type of treatment modalities. And troposemia inhibitors are the types of the chemotherapy drug that interfere with the action of the troposemia enzyme during the process of chemo treatment. So it is very much helpful, which control the manipulation structure of DNA necessary for the replication. So by inhibiting the cell division, we are able to control. Miscellaneous. So several useful types of chemotherapy drugs are unique, just like enzymes related to asparaginase. Okay, so retinoids, all these things we can go through. How chemotherapy works? Normally, cell leaves grow and die in in a subsequent way. Cancer occurs when certain cells in the body keep dividing and forming more cells without the ability to stop this process. Chemotherapy protocol involves destroying the cancer cell by keeping the cells from further multiplying. Unfortunately, in the process of undergoing chemotherapy protocol, healthy cells can be not. It is being affected and it is being destroyed also, especially those that naturally should divide quickly. So chemotherapy protocol strive to maximize the elimination of cancer cell by minimizing the negative effects that these protocols have on the healthy. So much research has been done to prevent the death of the healthy cells. So targeted therapy. However, it requires much time, I suppose. What is hormone therapy? Adrenal steroid inhibitor. This type of hormone therapy interferes with the hormone production by the adrenal gland. The adrenal glands are located on the top of the kidney. You know that. The outer proportion of the adrenal gland, that is adrenal cortex, produces the hormone called as corticosteroids. When these corticosteroids are blocked from being made, they are not able to signal the body to produce other hormones such as estrogen, androgen, glucocorticoids, mineralocorticoids. So by whenever there is a prostate cancer, we know that there is a surgery done to remove the testis. So why? Because when in the presence of testosterone hormone, the prostate enlarges and the metastasis is very much high. So at this time, if you are able to give this hormone therapy, it will be very nice. So testosterone without the surgery also, we call it as chemical castration, where the testosterone will not be produced, so that further shrinking of prostate will take place. So in the same way, anti-androgen targeted therapy is the result about 100 years of researchers dedicated to understanding the difference between cancer cell and normal cell. To date, cancer treatment has focused primarily on killing rapidly dividing cells, because one features of cancer cell is that they divide rapidly. So here, targeted therapy means it only goes to the cell where it divides very progressively, very fast. So it goes to a specific site and destroy the area. So monoclonal antibodies are a relatively new type of targeted cancer therapy. Antibodies are part of immune system. Normally, body creates antibody in response to the antigen. Okay, so the antibodies attach to the antigen in order to mark the antigen for destruction of the body's immune system. So if at all, for example, if we get a COVID, what will happen? Our body plans how to create a antibody against the COVID. So only we find COVID antibodies in our blood. If you take a COVID shot, what will happen? So there is a development of COVID antibodies in your blood. So whenever we put a killed virus, so body thinks that definitely there is something high alert. So it starts preparing the antibodies. But however, it is a short duration. It is stay for only short duration of time. Maybe you can see around about 80 to 90 days. Further, we should keep on taking the shots frequently to keep our immune system high. So, however, the vaccine has got multiple side effects and many problems. So it's not, however, we cannot use very frequently. Everyone go for a shot. So definitely, what we can do is that it's better to have a COVID infection rather than a COVID shot, because if you have a natural infection means, so you have got a lifelong immunity, where you should note the point that you should not take paracetamol nor the antibiotics. Then only body, when it sustains the normal temperature, temperature has to be sustained, like 102, 103, it has to be sustained. Then only body thinks how to combat with the virus. Then only it prepares the antibodies. So if it is been done, it's like lifelong memory cells get activated and resistance is lifelong. So I think this modality has to be followed. Coming to the monoclonal antibiotics, we give certain things, certain antigens, such that our antibodies goes and kill the cancer cell. This is the technique what has been adopted in the monoclonal antibodies. One is immunotherapy, biological response modifier, that is called BRM, or is called as immunotherapy, is a type of treatment that mobilizes the body's immune system to fight the cancer. Okay, let's come into clonal stimulation factor, tumor vaccines. It's not at all possible. Chemotherapy resistance, the body will not react to the cancer. Cancer is very much advanced that it rejects all the things, just like TB patients, where all the 12 drugs has gained the resistance, and now it's very much difficult to treat the TB patient with whatever the drugs which we have today. So side effect of chemotherapy, you are knowing, radiation therapy. So I think we are running short of time. So we will just go through. So now any questions? So you can ask at this time. So just we have gone through the what is cancer, the types, and what Sushruta Acharya, he is the father of modern surgery. So rhinoplasty, he was been the inventor of rhinoplasty. Okay, cesarean section, everything. So definitely you can ask any question. Just we have briefed up. In the next session, we will be able to deal with what are the modalities of Ayurvedic treatment and how the Ayurvedic treatment works and how we can do it better. Any questions you can ask? Yeah, please, madam. Yeah.
Yes, sir. Like you have explained us mostly the modern perspective of the cancer.
Yeah.
So I just wanted to know if you can give one example. For example, you just talked about the cancer with metastasis to liver and other organs. So can you, and even if Sattvajatik itself, if we are talking about how you practically apply it.
Okay.
The person who was sitting just beside me,
I think we are running short of time. So whatever you want to ask, you can ask in the just group. I will message you in a video thing. So because patient is waiting for me from a long distance, so I asked them to sit there, because last Sunday also we have skipped the class. So henceforth, whatever the question, please type it, or you can video that I will in the group itself, so that I will give my perspective. Okay. So thank you everyone for attending the class. So we will not be going to the question and answer hour because patient is waiting. So definitely